BIBISOO nasal spray promotes normal physiological activity of nasal mucus and mucosa. It also shields mucosal cells from viruses and pollen allergens. The spray solution has a higher osmotic pressure than body fluids, so it promotes the production of mucus-containing IgA and enhances natural immunity in the nasal cavity. Trehalose eliminates the cause of inflammatory response from cell membrane damage by protecting the mucosal fiber cell membrane with clusters. In addition, it hydrates and clathrates pathogenic floating substances that have invaded the nasal cavity, and at the same time it reduces the viscosity of mucus to prevent adhesion to cell membranes. By activating the frequency and amplitude of ciliary cells, trehalose promotes the transport of mucus produced in large quantities in hypertonic solutions, moisturizing and cleaning the nasal cavities. BIBISOO nasal spray promotes mucus metabolism in the nasal cavity and protects the nasal and nasopharyngeal environment through self-cleaning action. The spray solution is kept slightly acidic with a citrate buffer. The maximum active pH of the produced IgA is weakly acidic. Since the viral S protein is alkaline and has the maximum active site, the activity of the virus decreases when the nasal mucus is weakly acidic. The pollen husks themselves that enter the nasal cavity are not allergens, but the lipid allergens that are produced when the pollen husks are cracked cause allergic reactions. Since mucin is stable in an acidic environment, pollen shells do not crack in the environment of BIBISOO's citrate buffer solution, and are transported by mucus and discharged from the nasal cavity as they are. The pollen shell is transported in the viscous compartment without cracking and is discharged from the nasal cavity. The reason for this phenomenon is that BIBISOO nasal spray is several times more effective in improving pollen allergy than steroid spray formulations. Nasal sprays include a cleaning spray that cleanses the nasal cavity with a saline spray. Recently developed sprays containing polysaccharides. A nafazoline-based vasoconstrictor spray that suppresses mucus production. A spray containing antihistamines and antileukotrienes. Sprays containing steroids. Each has its own characteristics and drawbacks. Saline spray cleanses the nasal passages by washing away suspended matter that has adhered to the nasal passages. It has no side effects and limited efficacy. A polysaccharide spray was developed to act as a barrier to the nasal mucosa to prevent viral infections. It does not prevent allergic rhinitis or improve nasal mucus dynamics. Vasoconstrictor sprays have dramatic effects on nasal congestion, but are recommended for use within 5 days and should not be used long-term. It is a product that causes rhinitis, drug-induced rhinitis. Antihistamines and antileukotrienes are widely used as symptomatic treatments for nasal congestion and runny sneezing. Antihistamines cause drowsiness and difficulty concentrating. The main side effects of antileukotriene drugs are edema, hypersensitivity, headache, somnolence, and restlessness. The effect of steroid sprays is slow, and it seems that the effect is often seen after about a week of use. Side effects include irritation, pain, and dryness in the nose, but these are limited because they are administered locally. BIBISOO nasal spray does not contain any ingredients that cause side effects, so it can be administered continuously over a long period of time without worry, and it improves the physiological and physical functions of the nasal cavity for all rhinitis symptoms, making breathing easier. The result is better sleep, better concentration, and increased endurance in exercise. In recent years, sprays containing different saccharides have been developed in Europe and the United States. They are mainly developed for the purpose of preventing viral infections. The price is expensive, around 1,500 to 2,000 yen for a volume of 10 to 15 milliliters. Effects on allergic rhinitis are not included. Even if BIBISOO nasal spray is priced at 1,200 yen, it may be a reasonable setting for consumers compared to similar rival products.